Welcome to Mental Health Matters, a compelling series brought to you by Ontario Shore's Centre for Mental Health Sciences. Every week, we share stories of hope, recovery, and resilience, accompanied by expert advice and resources to help navigate and understand the complexities of mental health. Situated on the shores of Lake Ontario, Ontario Shores is a dedicated public teaching hospital. We provide specialized assessment and treatment services for those living with complex and serious mental illness. Our unwavering commitment to exceptional patient care is built on safe and evidence-based approaches, ensuring successful outcomes through clinical best practices and cutting-edge research. From adolescence to geriatrics, our recovery-oriented environment fosters discovery, recovery, and hope. Mental Health Matters is an opportunity for all of us to learn, grow, and support each other on this journey of well-being. Each episode focuses on breaking down the stigma surrounding mental health through crucial conversations and fostering empathy within families, schools, workplaces, and communities. Join us as we embark on an exploration of the topic of mental health. Together, we make a difference.
Welcome to Mental Health Matters, the show where we explore important topics related to mental health and well-being. In today's episode, we shine a spotlight on mental health in the workplace, discussing the challenges, statistics, and the role of mental health training. Our guest, Christina Fuda, a mental health training coordinator from Ontario Shores, joins us to share her expertise and insights. Let's dive into the conversation as we discover how we can create mentally healthy and safe workplaces. Welcome, Christina.
Thanks, Julie.
Thank you so much for joining us today.
Yeah, thanks.
To get started, perhaps you could share with us a little bit about your role at Ontario Shores, your title, and what you do.
For sure. Thank you so much for having me. So I am the mental health training coordinator for Ontario Shores. I've been here for 8 years now. And on behalf of the hospital, I've been fortunate enough that I get to go out in the community and train different workplaces, different people. I'd say in the 8 years I've been here, I've trained tens of thousands of people now all across the province in different work environments, and it's been a really great experience.
Thank you. Tens of thousands is a lot of people, and I know you've worked with a lot of really incredible organizations, and we'll dig into that a little bit later. To kick us off, something that really stood out to me in my preparation was the statistics around the prevalence of mental health concerns in the workplace and the impact on employees and organizations. Can you share a little bit more on that?
For sure. So I think we can all agree that, especially since COVID, we saw an increase in mental illnesses, especially in our work environment. So in pretty much a good year, we're looking at about 21% of the working population experiencing mental health problems that can impact their productivity. And so we also, know that 70% of employees are concerned about their work environment being mentally health and safety. And 14% of employees actually feel that their environment is not safe at all. So it's really become a huge focus for many workplaces to actually increase their benefits, their employee assistance programs, increase different resources for employees so that they feel more confident and that they feel more comfortable and safe. We're looking at about just under 80% of employers now have some form of workplace EAP programs, have some form of benefits. The biggest issue that we're seeing, though, is while, companies are starting to implement more of these resources to better support employee mental well-being, is the problem is that they're very underutilized. So we've got less than 15% of employees at most organizations actually even reaching out to these employee assistance programs.
Well, the data is definitely impactful and staggering. Can you explain why do you believe that these mental health conditions are prevalent in the workplace? I know you touched on COVID-19, and perhaps you could expand a little bit more on the impact to employees and the organizations.
For sure. Well, you know what? Every organization is going to be a little bit different in terms of their psychological health and safety hazards that they're experiencing. But for most workplaces in general, it's going to be overload of stress, is putting too much on employees' plates. It could be things like not allowing for sick time or not providing enough vacation time. People can sometimes feel burnt out. overtime hours, decrease in employee culture and satisfaction, trust in the organization. So all of these sorts of things can actually lead to poor mental health corporate culture and work environments for people. And so it's really a matter, though. I have to give a huge shout out to the Mental Health Commission of Canada for starting the national standard for psychological health and safety in the workplace. I always encourage workplaces to check this out and then go through the different 13 psychosocial factors that they can actually look at to see what is impacting their work environment. So what are the different hazards that their specific work environment is, causing or what's happening, so that they can identify them and then work to eliminate a lot of those hazards, typically like the same way that we would for physical hazards in the workplace, right? You see spills, you're going to do something to eliminate that hazard. And so it's the same thing with psychological health and safety.
Excellent. I just want to circle back. You mentioned the low utilization of EAP and other resources in the workplace. What do you think contributes to those trends, and what can organizations do to increase the utilization?
You know what, that's one of the big reasons I love what I do. So is I find a lot over the years is that employee assistance programs, employees often know that they exist. So, they get the corporate emails, they see things about their employee assistance program. They'll see posters around the office. They know it exists. But what we find a lot of the times is that people don't know when to use them. In my experience training over the years is we'll talk about different mental health resources and employee assistance programs, and employees will still at the end of the day, I'll have spent an 8-hour day talking about these sort of resources. At the end of the day, they'll still come and be like, hey, this is the problem I'm experiencing. This is what's happening in my family. This is what's happening at work. What should I do? And I'll often say, have you ever called your EAP? No. Is that a really good reason to call? And I'm like, yeah, for sure. That's a great reason to call. And so for so many people, I think they just need to be validated as to when they should reach out to an employee assistance program. A lot of employees also don't really recognize what mental illness is. They have a hard time seeing it in themselves. They have a hard time seeing it in others. And so that's where the gap comes in. It's like, I know what the employee assistance program is. I just don't know what mental illness is to know when I need to reach out to it. Is a lot of people tend to even think of mental illnesses as more extreme than they are, and they don't recognize that we can use employee assistance programs for when we're feeling mild cases of anxiety, mild cases of depression. And that's where I think training is really important to add along with all the wonderful communication strategies that employers will do. But training is important to really help people identify mental illness in themselves and others and know when to reach out.
It's a great segue. You talk about training and your role from Ontario Shores as the mental health training coordinator allows you to go into organizations and conduct mental health training in a variety, and we'll touch on that a little bit later in the episode. Can you talk about the benefit to an organization for bringing in someone externally to lead a mental health training on site?
Thank you. Yeah, you know what? I've had lots of organizations, they'll want to do internal training. They'll get their HR staff or their, learning staff to come in and train employees. But something that I've heard that people really appreciate about an Ontario Shores trainer coming in is that, for one, it feels more personal. It feels more confidential. So we're talking about a very private conversation of mental health. And a lot of employees don't feel comfortable knowing that it's an internal employee that they could be opening up about their mental health experiences with. And so when you send in an external trainer who's also, works in a mental health facility and knows a little bit more about community resources and mental health, is we find that people have more trust. They get more of that personal experience. In my time delivering this training, I've seen some amazing transformations in classrooms where, we'll get in and the employees will be very shut down and very quiet. And by day 2 of the training, everyone's talking about their own experiences with mental illness and, whether it's their experience or a loved one. And the whole vibe just changes. And, you can just see this culture change happening within the organization. And I don't know if you would get something like that with an internal staff. So our trainers are just, they've been in the mental health field for, at least 8 years. And yeah, they're really, really awesome at helping people feel comfortable to talk about it.
What would, and perhaps you could talk about yourself rather than the other trainers,
Yeah.
What education do you have? Of course, being an employee of Ontario Shores brings credibility, and that's really important, I imagine, to foster trust and confidentiality in these organizations. But I know that you bring some really interesting credentials to the table. So would you share that with our viewers?
Sure. Yeah. You know what is so myself personally is I did do my degree in psychology before I was here at Ontario Shores. I did my master's degree in neuroscience. So I find that for my expertise when it comes to mental health training, I work really good in technical environments because I find some workplaces they're so afraid. They think mental health training, somebody's going to come in and, they're going to make us all hug it out. And it doesn't usually look
That's
like
not
that.
the case.
No, no. And so I talk to them a lot about the more technical side of the brain and how the brain works and, what is mental illness. And so that's my perspective. But in all kudos to, the other trainers that we have as well, is we have one that really specializes in, adolescent mental health. She was a child and youth worker for many, many years, working even in emergency rooms. And so she takes a very different approach. And so what we really try to do at Ontario Shores, we try to match the instructor's expertise with the organization that we're going into.
So that's a discussion that an organization who's looking to move down this path for training, they can have a discussion about perhaps who makes the most sense for their organization.
Exactly. And we have another trainer. She's, recently graduated, but she works really great with college students. And so, she's got more of that experience with them. So yeah, we really have a discussion to see what their needs are, their demographic of their workplace, and try to match them.
You talked about the transformation over a 2-day session. Do you have any stories or examples that you could highlight about the impact of mental health training?
Oh, I have so many stories. It's like over the years, there's just so many that stand out. But, one of them that always really stood out to me was a bus driver many, many years ago. And, he sat there for 2 days very, very quietly, listening about mental health. And at the end of the 2 days, he kind of waited for everyone to leave. And it was just me and him packing up. And then he came to me and he's like, you know what, after this couple of days, I feel like I might have depression. I never thought about it before. And he's like, and he actually, we had a conversation. I encouraged him to reach out to his doctor and mental health professionals, the EAP program, all of those wonderful things. And about 6 months later, I got an email saying, I didn't know I could feel this way. And so those are the kind of reasons that I love doing this job.
Absolutely.
Yeah.
How many years have you been doing this?
8 years now.
8 years.
Yeah. It's been actually over 8 years, 8.5. So yeah,
Incredible.
It's been a great 8 years.
So when I consider implementing mental health training in the workplace, what resources or support can organizations access to get started?
Well, you know what? Find a mental health organization like Ontario Shores. You can always reach out to one of them, even in your local area. You can reach out to us. And yeah, we can just have a discussion. We can see what the kind of needs are of your employees, what the need of your workforce is, and talk about different options. So we have everything from, 1-hour webinars and seminars all the way to 2-day certification training. So yeah.
Is this something that you recommend on an annual basis for organizations of one time? When I want to think about sustainability of this sort of training.
For sure. So you know what? It really does depend on the work environment. Everybody's going to have their own needs. Personally, I think it's best to everybody should really get the 2-day certification training. Mental health first aid is it's just wonderful, and not just for the work environment, but everybody goes home at the end of the day too. And this can really help you in your personal lives as well, with your family and your friends. And if things are going well at home, things go well at work too, and vice versa. So I would encourage people to, maybe once a year do something like the mental health first aid training, and then continue every year with maybe some additional webinars and seminars, maybe some additional upskilling. We also started suicide awareness training in the past year as well, which is really, really beneficial for especially groups that work with higher risk populations of people that could be at a higher risk of suicide.
What if someone is watching today and they're an employee, not necessarily a decision maker on this sort of training? What do you recommend they do to connect with what department, who in an organization has the ability to help form these decisions or create a strategy?
You know what I find most of the time is we start with the HR team. HR team's always a good start. Health and safety rep. So if there's a joint health and safety team, they tend to be the best ones to make those decisions, to start implementing things. Of course, you always need buy-in from senior leadership, so that can take a little bit of time, but we're always here to help as well. Just create a, even presentation just to outline what their employees will be trained on and the outcomes and benefits of such training. And so for anybody interested, interested is, reach out to us at Ontario Shores. You can always find another organization that might be offering something similar, but just making those first connections and, talking about what the needs are and trying to get that buy-in from senior leaders in HR and joint health and safety unions. I find they're always the ones that, really are really excited about it.
And I imagine if someone were to reach out to you, you could have a discussion with perhaps who the best person to talk to, give them some key messages,
Yes.
and help to make that connection. Thank you so much for joining us today. I encourage anyone who would like to learn a little bit more about the mental health training that Ontario Shores offers to connect with Christina. We offer a variety of different options for workplaces to consider. And remember, mental health matters in the workplace and beyond. Join us next time on Mental Health Matters as we continue the journey towards mental health and well-being. Welcome back to Mental Health Matters. I am so pleased to welcome our two guests, both Amber Smith and Melissa Geary. In this episode, am handing over the reins to Amber. Thank you, Amber, who will take over the roles as host and interview Melissa as we talk about all things mental health in the workplace.
Thank you, Julie. It's a pleasure to be here today. My name is Amber Smith, and I'm a Learning and Organizational Development Specialist at Ontario Shores Centre for Mental Health Sciences. Happy to be here to continue the conversation on workplace mental health. My role has to do with employee engagement and leadership development, as well as our integrated wellness strategy. So it's a pleasure to be here and focusing in on this topic. And of course, I'm so happy to have you here, Melissa, joining us today. Welcome.
Thank you. I'm also very excited to be here and for the opportunity to sit down and chat with you.
Great.
Yeah.
Tell us about your role here at Ontario Shores Centre for Mental Health Sciences.
Absolutely. So I've had the great fortune of working here for 9 years now as a recreation therapist. And I've worked kind of in many different roles and departments. I started in forensics. Then I made my way over to central recreation, which really gave me the opportunity to work with both inpatient and outpatient populations. And then I've also found my niche with the adolescent inpatient unit, which is dear to my heart, that population. And then actually recently, I just decided to try something different, and I'm working temporarily as a caseworker in one of our outpatient clinics, which has given me a whole new perspective and opportunity, which is amazing.
That's a great career journey,
Absolutely.
And we're so happy to have you here.
Thank you.
We're here talking about workplace mental health. So let's start by talking about that term. What does workplace mental health mean to you, and why is it important?
Yeah, absolutely. I think that's a fantastic question. You know, for me, when I think about workplace mental health, I think about kind of how do we cultivate kind of a positive work environment and positive morale that would positively impact the staff that work here. You know, for me and for anyone, working adults, we spend a lot of time at our workplace, right? It's a lot of time spent. So it's important to work somewhere where we feel like, you know, we're getting the most out of it and really working in a way that impacts us positively.
I love what you said there about that positive morale and the importance, of course, of having that in our day-to-day work, given how much time we spend at work. So I want to talk next about the differences in terms. So we've talked about workplace mental health, and we also hear about workplace well-being. From your perspective, are those two terms similar? Are they different? And how would you describe the strategies for each of those?
Yeah, absolutely. So for me, definitely, I think that they go hand in hand. You know, I think if you work somewhere that focuses on workplace wellness, it just naturally boosts workplace mental health as well. I actually prefer the term workplace wellness. I don't know if it's the rec therapy background in me, but I feel like it has more of a positive kind of feel to it. And I think that wellness is kind of a concept that so many people can gravitate to, and it's something that we all strive for. So when we looking at workplace wellness, you know, what are the initiatives that organizations are doing and to help with that, you know? And it is very important. You know, I think about here we have, you know, spirit days, and I'm one that I'll never miss an opportunity to dress up on a spirit day or, you know, play in a staff hockey game or a staff baseball game. So I think it's important that organizations really look at the wellness initiatives that they're doing and how that can really impact, you know, workplace mental health.
Thank you for that. And of course, we love the energy you bring to those events and to our spirit days. So let's talk a little bit more about what you do personally as a professional in the workplace, what are those strategies that you tend to gravitate to personally or use to uphold that sense of workplace wellness and that sense of positive morale or even positive psychology?
Yeah.
What do you do? And maybe how do you encourage others around you, whether it be teammates, even some of our patients, to do the same?
Yeah, absolutely. So, I mean, like I said, I'm very fortunate that my career is in rec therapy. So I get to do that on a daily basis with the patients that we work with, and even staff, encouraging them to work on their own wellness and self-care strategies. So for me, it's something that comes a little more natural, but I often have to remind myself to practice what I preach a little bit.
Yes.
And so I do try and get involved as much as I can with, like I said, the initiatives at Ontario Shores, just to kind of feel that connection to the greater community here. Every day at lunch, I go down and I play badminton with a group of staff, which is a lot of fun. And I encourage my colleagues to come out and do things like that, or just meet up for lunch. We as rec therapists and just in general in healthcare, it's busy sometimes, and I think we need to remember that we need to take the time to slow down, take that time for us, reconnect with others, maybe not to do with work specific things, and just slow down, and also too, we have large patient events here, and they're a lot of fun. So I always tell staff, come to those and come have fun as well with the patients. Work on your own wellness every day while you're here. Why not, right?
Absolutely.
Yeah.
I appreciate how that concept of bringing patients along and bringing colleagues along also helps to boost that concept of recovery in mental health. And that, of course, as what you said, is practicing what we preach here.
Absolutely.
I also really appreciate how you've mentioned different types of wellness. I mentioned earlier, we talk about our integrated wellness strategy, which has those 9 domains of wellness. And so there's so much more to just, our mental health than just that physical well-being. So you've talked about emotional well-being, social well-being, even occupational well-being, how to find that sense of positivity, morale, engagement in what we do, and finding wellness at work through those different domains. Thank you for that. I do want to maybe switch the focus just a little bit within the realm of workplace wellness. We've heard a lot about equity, diversion, inclusion, belonging as now being this necessity for workplace wellness in particular. Tell me more about the practical strategies you could offer other organizations, even our organization, to help make these things a priority for workplace wellness.
Yeah, absolutely. I think this is such an important topic, equity, diversity, belonging. These are pillars that I think need to be ingrained into all organizations. You need to work somewhere where you feel like you're understood and equal and valued, and that there's no barriers around that. So I think it's huge. I actually had the opportunity a few months back to sit in on a focus group around equity and diversity specifically. And it was just such an incredible and empowering experience to be able to come together with others in the organization to really just talk about all things equity and diversity and inclusion, and where are we at, where do we want to go, and it was just very powerful to listen to people's experiences of other places maybe that they've worked where they didn't really take this into account, and kind of the barriers that created for them. We were encouraged during that, the 4 different sessions to then in between go back with our colleagues and chat about it, and what are some ideas that we want to bring here to our organization to make sure that we're cultivating that culture of inclusion and equity. And I know a lot of ideas came from that, and we've already started to kind of implement them into different action plans. So I would say that's a huge piece of advice that I have for organizations. If you can do, even it doesn't have to be a focus group on that level, but something to that scale where you can bring your employees in for just an open, honest conversation around the topic, and where they see it going and what more can be done is just incredibly empowering and super necessary.
I appreciate that.
Yeah.
Thank you for sharing and opening up about that. It's incredibly important, and I'm happy to hear about this participation that you were able to have, that organizations don't have to do this in silos. It's not just one department's job to uphold these pillars, as you talk about, of equity, diversity, inclusion, belonging, but bring the people along, have them talk about their journey, their experience, their lived experience, if you will, and to make a workplace that truly, where everyone feels like they belong. Thank you. Thanks for sharing that. So let's also talk about the importance of seeing workplace wellness played out before us in the workplace. What do you think, or from your perspective, how important is it that leaders model the way when it comes to workplace wellness?
Yeah, absolutely. I think leaders have such an opportunity to kind of start these conversations with their teams or their employees around, wellness and what does that look like for you, and it could change on a day-to-day or a month-to-month basis, but encouraging that dialogue and working with your teams to kind of really foster the wellness within your teams is huge. I also think that, naturally teams feed off of their leaders. So if you have a leader that maybe doesn't participate in workplace initiatives or doesn't really get on board with wellness and workplace mental health, it can kind of trickle down. You see managers sometimes that are really busy all the time and they're working through their lunches or having meetings through their lunches, right? Like it's not even good for them. Like they need to also take the time for themselves and kind of model the way for their teams. And I go back to that I play badminton on lunch hours, and for the longest time it was just going down and playing with a group of my fellow colleagues, and I didn't really know what their working backgrounds are or were, but as time went on I started to realize, oh man, there's a lot of clinical managers that come down on lunch and play. And then I started to realize that half of their teams also came down to play, right? So you had these managers that were encouraging their teams to come out, and I just think that that's incredible. Like we're all coming together to hang out for an hour and just do something fun. And again, like that starts with the leader that you have and the importance that they also put on workplace wellness.
Thank you for sharing that. That is a great example of how leaders can encourage workplace wellness and upholds, like I said, those domains of wellness, whether it be physical, emotional, social. It's great to hear that these things are happening at Ontario Shores. Thank you, Julie, so much for this opportunity to co-host today. Melissa, as we wrap up, are there any final words that you have or final message that you'd want to share with our audience today about workplace wellness?
Yeah, absolutely. I mean, again, like I think a big takeaway is like you're only as good as you feel, right? So if you come to work and you work at a place that really fosters workplace mental health and wellness, I just think that just boosts so much morale and productivity. And working in healthcare, if staff are satisfied and engaged, in turn you're just going to get better engagement and interaction with our patients that we work with or the clients that we see every day. So I just think it's imperative for workplaces to really look at this and the role that they can play, and reflect back on what are you currently doing for wellness initiatives, and to have a little fun. Everyone needs a little fun in their day.
I agree. Yeah. And thank you for this. This has been fun. Yeah. Thank you, Julie. I'll hand it back over to you.
Perfect. Thank you. And to wrap up the episode, I just want to say thank you again, Amber, for leading the discussion. Thank you, Melissa, for your contributions. I think there's some really important takeaways for individuals, for leaders, for organizations to implement true workplace wellness into their overall strategy. Thank you for joining us today. This is Mental Health Matters. I'm Julie Van Hardingsveld, and we'll see you next time.
Hello there. This is Karim Mamdani, and I'm proud to introduce myself as the President and CEO of Ontario Shores Centre for Mental Health Sciences. Thank you so much for tuning into today's episode and for joining us in these important conversations about mental health. I just wanted to take a moment to express sincere appreciation to the incredible team at Ontario Shores for their exceptional work. Our team of compassionate and skilled clinicians and staff work tirelessly to provide life-saving treatment and unwavering support for our patients and their loved ones who are facing the challenging impacts of mental illness. At Ontario Shores, recovery is possible and there is hope. I invite you to visit ontarioshores.ca to learn more about our work. On our website, you can explore our career and volunteer opportunities, learn about our programs and services, and find out how you can make a difference through donations.